instance, this is a research question. Basha, this is a research question. Boy بزانن. What is this the research question say? Here they say pilot trial. So what they say, okay, it's a pilot trial of high dose vitamin or vitamin C, Basha, in critically ill COVID-19 patients. This is a research question. So what the research question كان أويا كأواني أو نخوشانن ل ICU كوتون دين high dose vitamin C عم بني سدي الريزلت كيف research question يانا. It is a question or not? It is a question. So what the question كان شيء برسيارة كأنا ويا كإيه كوين نخوش ل ICU كوتبه يبقى بين high dose vitamin C عم بينه شيء أبيه outcome كي شيء أبيه جماعة للريسيرش question هو أبي بزاني كم variable. So we come to the كم variable أو outcome variable and the exposure variable. أبي بزاني وعكو دائما خود بزاني شو كبابتك ولا سر أمي قرنجيك لا سر أمي. So what are your outcome variables in the research question and what are the exposure variable in your research question? So here we said exposure variables and outcome variables. بينوسم يا خوتان بينوسم. باش. The other كعلم outcome variable نايو كتير هي بو outcome variable بيوتري dependent variable. بيوتري dependent variable. The exposure variable نايو كي بيوتري independent variable. باشا. باش. دست خوش. Now, for here, أجر سيدي أم بكن، سيدي أم research question أبكن. بهيني إيوا، بتصوري إيوا exposure variable ما ليرة شيء و outcome variable ما شيء ليرة. So vitamin C is what? You give vitamin C. That means you expose patient to the vitamin C. So it is exposure variable. So it is what? Exposure variable. لبرو كوملنا خوش هي expose يعني كي بتشي vitamin C. And what are the outcome variable here? The outcome of COVID knows that. The outcome of COVID. This is the ICU. Could be, I don't know. But could be the outcome variable is the severity of the disease. Or could be the mortality. Because in the ICU, they said, okay, they give high dose vitamin C to the patient and see the outcome. The outcome is what in the ICU? The severity of the disease. Severity of the disease is the outcome. Basha? And the could be another outcome, secondary outcome. So هلا هموت يجينو إزانسي دائما primary outcome here, which is the main research question. Primary outcome is the main research question, and could be the secondary outcome is what here is could be the mortality. Could be the mortality of the patient. Basha? So this is very important to know. The exposure variable and the outcome variable. So for instance, I do the study. My research question is the relationship between the breast cancer and the risk factors. Breast cancer and the risk factors. What is l'area exposure variable or outcome variable? So the risk factor is the exposure variable. And the outcome variable دائما outcome variable لك يا إما severity يا إما outcome مثلا يا إما مثلا بونمونا prevalence زياكا يعني incidence نخوشيك زيابكا. واضح يا جماعة؟ باشا. So for instance أميان لدي outcome كا risk factor و prevalence بابلين breast cancer زياكا كمكا يكشي قلوب يا prevalence risk breast cancer زياكا كمكا. باشا جماعة. For instance, effect of certain medication, for instance, medication A, on the blood pressure. So blood pressure will be what? blood pressure أبي بشي أبي outcome. And this medication will be what? Exposure. باشا جماعة دوريك كم هو دايكان بوش شيردا بوشيري سرشتي دورم كدوتو دورك أبي بشي موادي دورك أبي بإكسبوجر ليفلي educationي دايك كان أبي بشي واضحة جماعة. Did you get that? You got it. عرب الله طخت. So you got it. باشا جماعة. So this is from the hashtag نتيجة هو. So this is from the research question. From research question you develop what? You develop the hypothesis. Basha. From the research question you develop the hypothesis. Okay? This is just from the... And we do have what? We do have two types of the hypothesis, Jamaat. We do have what? We do have two types of hypothesis. The first hypothesis, we call it null hypothesis, Jamaat. The first hypothesis, we call it what? We call it null hypothesis. بعربي بيوتي فرضية صفرية. فرضية الصفرية. باشا. What's the meaning of the فرضية الصفرية or null hypothesis? Every time this null hypothesis say there is no association, there is no effect. باشا. So you say okay, I'm mobile رنجي رش. أول رنجي رشني. Null hypothesis عليه. رنجي رشني. رنجي كتير ترى شيء الله بجري. هلا بجري بالام أم موبايلك توعي ساكبة بدست وين رنجي رشني. باشا. This is the null hypothesis. Here, what is the null hypothesis here? They say, okay, the pilot study, the vitamin C decreasing their hypothesis is decreasing the severity, decreasing the mortality. The researcher hypothesis. The researcher hypothesis is what? They say that the vitamin C is decreasing the mortality or severity. But the null hypothesis, no. There is no any effect. دائما null hypothesis, they say there is no association, there is no relation, there is no effect, there is no impact. Okay, this is the null hypothesis. But the secondary hypothesis, we call it what? We call it alternative hypothesis. This is the researcher hypothesis. This is what? This is the researcher. This is what you are trying to do to prove it. أو عليه باشا أو عليه إنينيا relationship إنيا إستودي وكو researcher إثبات يكي بزانا هيا رنجي الرش هيا رنجي الرشت يا جماعة. could be دواي might be باشا might be هالرشة might be قسكي أوا قسكينا الهايبوثيسيس might be من الله خمو فيتامين سي أدم احتماله من و ببي خبري خوم باشا علم فيتامين سي تأثيري هي could be not قسكي null hypothesis درجة واضحة جماعة. So this is the null hypothesis and alternative hypothesis. You've got. So from the research question you develop the hypothesis. From the research question you know the types and the importance of the variables there. I mean the outcome variables and the exposure variables. And from the research question you develop the aim of your study. باشا جماعة. هل الريسيرش question كوا you develop the aim of the study. So what is the aim, the main aim of the study, of this study? So the main aim is to evaluate or investigate the impact of a high dose of vitamin C on outcome of COVID-19 in the ICU. واضح يا جماعة. So from the research question also you develop the what? You develop the aim of your study.